removal of a PIC or central line. The supplies you will need are 2 face masks, a clean pair of gloves and a sterile pair of gloves, a suture removal kit, if applicable, sterile gauze and triple antibiotic ointment, a transparent dressing large enough to cover the gauze, and extra tape as needed. And for a PIC, you'll need a tourniquet in case of emergency. Apply a mask to yourself and to the patient. Wash your hands and apply clean gloves. Open the suture removal kit if the line is sutured. Prepare a sterile gauze dressing by placing triple antibiotic ointment on it. This will be the dressing applied to the exit wound site once the line is removed. Place the patient in supine position with the head of the bed flat and have the patient turn his head away from the catheter. Remove the dressing and the stat lock. Remove gloves and wash your hands, then apply the sterile gloves. Cut the sutures and pull them through the skin, being sure to remove all the suture material. Instruct your patient to take a deep breath and hold it in. Slowly withdraw the catheter in one continuous motion, and with the other hand quickly apply pressure over the insertion site with sterile gauze that has the ointment. Please note, if resistance is met, pause momentarily and retry. If resistance is still felt and the arm is not swollen, try to massage the arm and/or apply a warm compress, and try to remove later. If resistance is still noted, stop the attempt to remove the catheter and notify the MD. When a catheter is out, immediately cover it with an occlusive dressing by placing the sterile gauze with ointment on the wound site in order to create a seal of ointment to prevent an air embolism. Then cover the gauze dressing with a transparent dressing and secure it with tape. Maintain pressure for 2 to 5 minutes until hemostasis has been achieved. Check the integrity of the catheter tip. If the tip is intact and the PIC line measurements concur with the chart, take note of this and record it. If the line is not intact or the patient becomes symptomatic, this is an emergent situation and you need to notify the physician immediately. Emergency measures for catheter breakage. If the line is a PIC, immediately place a tourniquet on the arm proximal to the PIC insertion site so that the vein is obstructed but not the artery flow. To do this, check the radial and ulnar pulses. Do not leave the patient and call for assistance. This is an emergency situation. Do not allow the patient to ambulate. Absolute bed rest is necessary. Check and monitor the vital signs frequently, apply oxygen, and start a peripheral IV. If a patient becomes short of breath, turn the patient to their left side with their head down. This position is meant to keep the catheter fragment in the right ventricle and out of the tricuspid valve and pulmonary artery. The medical doctor and radiology needs to be immediately consulted. If the catheter is shorter than expected, maintain bed rest and contact the physician for a follow-up chest x-ray. The patient should remain flat for 20 minutes after the removal of the catheter. Keep the site covered until a scab forms at the site.